This morning, a woman heads to surgery to receive a new heart at one of the top heart transplant centers in the country. And Ken is inspired to take the mound less than 1 year after transplant. Interventional cardiac surgeons prepare to fix the tender heart of a 3-month-old boy. And 5-year-old Omari is heading to his first day of kindergarten, just like the rest of his classmates. This afternoon, farmers harvest vegetables from our hydroponic greenhouse, which yields more than 5,000 pounds of produce each year. And a high school senior named Luis is learning the nutritional value of baby kale. This evening, Lois is prepping for surgery to receive a double lung transplant. And Craig is accompanied by his guitar instead of an oxygen tank. All day, every day, Newark Beth Israel Medical Center and Children's Hospital of New Jersey are committed to providing world-class leading-edge medicine to every patient. A top teaching hospital offering state-of-the-art patient care and an anchor institution that thrives on empowering our neighbors and partnering with our communities to live healthier together. Newark Beth Israel Medical Center and Children's Hospital of New Jersey. Let's be healthy together.
Good afternoon. Thank you all for joining us today for Women's Wellness Wednesday. We are so honored to have renowned sociologist, educator, public scholar, and author, Dr. Janice Johnson Dias. Welcome, Dr. Janice.
Hello, thank you for having me. I'm very excited to be here.
Thank you. As always, we encourage everyone, please send your questions in the chat, and we'll do our best to answer all of your questions during this session today. Even if we have to go a little bit over, that's fine. That's how we do things here. Dr. Janice, you have dedicated your life to addressing the challenges of low-income Black mothers and their children. You recently wrote a book, Parent Like It Matters, How to Raise Joyful and Change-Making Girls. Great book. And we're going to talk more about that later in the discussion. But most people here at Newark Beth Israel probably know you for your work as the president and co-founder of the Grassroots Community Foundation and the Supergirls Camp. We know the Supergirls have visited Newark Beth Israel, they've toured, they've met with many of our leaders. How are they doing, and how have you and your girls managed through this pandemic?
Oh, I would say the girls are doing well, like everyone else. They're excited for a summer after being indoors for 15 or so months. It has been a long go. We have had, last year we had Super Camp virtual, and we social distanced on Fridays as an opportunity to see faces. It was challenging, but it offered us an opportunity to be innovative. This year, our girls participated in a host of things, and we opened up our doors with our virtual series for classes like quantitative public health data literacy, where we partnered with NYU to teach folks how to use and develop their quantitative literacy skills, but also to better understand public health, because so many numbers are coming at our girls and are coming at people, and it's hard to make sense of it. Our girls also cooked virtually, so that was a gift of the pandemic, is that if we tried to negotiate how we were going to do a cooking class, that might have been more difficult, but this year we were able to cook together with Dr. Olivia Afuso, who's an epidemiologist and an ultra runner, and so we made meals. Last summer, we had the pleasure of learning how to sing virtually, both the parents and the girls. So Asia Graydon from Kindred the Family Soul worked with our girls, and they sung That's What Friends Are For. And No Long Bullock worked with our parents. And so we have been really creative during this process. But like all young people and adults as well, it has been extremely challenging. At Grassroots, we're dealing with high-performing girls in white spaces. And so those girls have had to tackle, deal with, negotiate all the issues related to the intersections of race, class, and gender. And so they have given us a lot to think about. And so as we do the work going forward, we are going to really incorporate what we've learned from them. To preserve my own sanity, because I also had a pandemic, we are not hosting Super Camp for the first time in 11 years this summer. We're working instead on the curriculum because, as you know, the book is out. It talks a lot about Super Camp. People across the globe are trying to do their own Super Camp. So we are finalizing, we're spending the summer finalizing the curriculum so that we can do some training in the fall so that people can be given the opportunity to run their own Super Camp. It also gives me a chance to rest because I'm tired too. And and I really, really wanted an opportunity to do so. But our girls are also helping to support our program, our newest program for seniors, titled Sphinx at Georgia King Village, where we are doing some cooking again, some gardening with youth and seniors and utilizing that space. So we welcome people who are interested in or live at Georgia King Village to really participate in that program. And in the fall, our girls will be together with seniors for our Give Thanks work and to ensure that we provide food and food insecurity, for address some of the food insecurity needs of the community here in Newark, also in Philadelphia and in Georgia. So that's kind of us.
That's great. That is amazing. I mean, everyone, we've all had to learn how to do things in a virtual space. Obviously, these webinars that we're doing right now are part of our learning here at North Beth Israel, changing the way we communicate with our community and adapting to everything that's taken place. It's great to hear that the Super Camp is going to be expanding and you'll see more across the country and hopefully, around the globe. So that's a nice little silver lining, right?
That is a great silver line, especially if Jamaica gets up and running.
That's nice. That's nice. So today, though, obviously, we're talking about some of the negative impacts, if you will, of the virus. You talked about all that the girls have had to navigate in this new space, and we've seen the disparities that have come about. We've known about them. I say we've known. If you work in healthcare, you know that there are disparities, and just as a human being, a person of color, you know that there are disparities. But I feel like it's come more into the public light with this pandemic. Can you talk to us about the specific impact that it's had on Black and Brown women?
Yeah, I'd be happy to talk about it, but saddened by the information itself. So I think in many respects, like you said, we have known that America is deeply unjust. We have known that Black women have bore the burden of the health challenges that the world has to offer, and certainly the US has to offer. But the pandemic gave us keen insight into how this is operating. Last night, I texted several of my friends about what I anticipated a conversation like this should have been called. And in many respects, it really is about the fact that those of us who have vaginas, who live in the bodies of girls, we have experienced a severe penalty for our womanness, for our girlness in this pandemic. So a major outcome is that Black and Latino women, and Black women in particular, have felt compounded challenges. Our intersectional identities have created a nexus of problems. So for those of you who don't know, when I talk about intersectional identities, I'm talking about people who have multiple identities in vulnerable groups. So where we talk a lot about Blackness as a penalty in comparison to whiteness, we talk about womanness as a penalty in comparison to maleness. And what happens for Black women is that the significant majority of us experience these compound penalties. So we know that in 2019 is that Black and Brown communities had the highest rates of health issues as a result of the pandemic. And I think for many people, the interpretation is that the virus hit us hard, but the virus hit us hard because of the historical conditions that have stressed our lives. So we've been historically compromised with poor health pollution, bad neighborhoods, low wages, and racial stressors. And then there's a virus, and then there's a health virus, not racism virus, but health virus. And so those kinds of things create a load on the body that makes it difficult to stay healthy. And what happened in the pandemic is that America as itself really does not understand what public health means. We have a lot of conversations about individual health, people behavioral health, people eating right, exercising, etc. But this became an incident of where people needed a reframe. And that reframe, especially if we think about what public health is, which is to promote and protect the health of people, is that reframe required that America think of Black women as a viable population worthy of saving. And what's clear is that America was not up to the challenge. So for many people who are on this webinar, I just want to acquaint you with some realities of America that made things more difficult for Black women. In America, America is 76% of people on the US Census report that they are white alone. That's 76. That means 3 out of 4 people who live not just in the contiguous 48 states, but in the 50 states that is America, report that they are white alone. 13% of those people report that they are Black alone. They're no other thing, right? So that means that America is largely a white society, which is very different from Newark, right? Newark, 50% of Newark is Black, right? 28% of Newark are people who report that they are Latino. In the US, 50% of the US population report that they are women or born female. In Newark, we have 54, almost 55%. So Newark is not a representative population of the United States. And so I think sometimes people get confused because what's happening in America and what may be happening in Newark can sometimes be parallel, but can sometimes be different, right? And when we think about the virus and what has happened to women, we have to think at 2 levels. We have to think about the 76%, and we also have to think about what's happening in the city of Newark. And so I just want to make sure that people understand. Dr. Kamara Jones described the virus as the virus's singular job, the virus that is COVID-19, its singular job is to find our vulnerabilities and in our bodies and to exacerbate those vulnerabilities. Well, racism works the same way, and misogynoir, the intersection of hating Black people and hating women, does the same way. Our major vulnerability in America is our disdain and dislike and abhorrence for Black women. And so when you take a society that is abhorrent and hostile as a host to Black women, and then you take a virus that attacks and exacerbates problems, you are bound to get issues. So I just want to read you some data on what has happened with women. So based on the 2018 American Community Survey, before 2019, half of all working women, that's 46%, worked in low-wage jobs and worked roughly about $10 an hour, right? And that is, of course, we know, not a lot of money. And Black women are more than half of the workforce of low-wage workers. We also know that 15% of those people are single parents, and they are between 25 and 54. And almost 2/3 of them work full-time year-round. And yet 40%, 41% of them are more than 200% below the federal poverty level. That's equivalent to $43,000 for a family of 3, right? So we're the working poor. So the working poor is, of course, I just want to be clear, it is a term that should not exist. If we say that America is a capitalist society, work should equal non-poor. But in America, we have a set of people who consistently work almost 60 hours a week and are poor. Those people are women. The majority of those people are Black women. And these women have health issues and they report health concerns. So when the virus came, these women were hard hit in multiple ways. So they were hit in terms of economic distress because they occupy low wage work that had a lot of loss, right? So your service industries had lost. They were also, even though so many were essential workers, many of them still were lost. When we look at who lost the job, the data reported that it was when employers had to make a decision, the decision was to not have Black women. And that is when racism and health come together. But then we had other systems that failed Black women and their families. Healthcare systems and school systems failed us, right? So childcare fell apart. And the majority of women between 18 to 64 work and have children. And according to the Bureau of Labor Statistics, right, we know that Black people's labor force participation, how much we work, is on par with Asians and whites. Contrary to what people are thinking, Black folks work. So 62.8% of Black people, 62.3% of whites, 62.8% of Asians, all have the same labor force participation. You should be amazed by this. Why? Because given that America is racist, given that America has unequal access to opportunities, the fact that Black people still manage to work at a rate of other groups that benefit is an amazing thing. And among all the people working, the group that's working the most are women. So the pandemic hit us harder than anything else. And it hit all women hard, but it just hit Black women worse. And it mostly hit us because of the pre-existing conditions of poverty, work, and hatred towards us. And so we are coming out of the pandemic where 1 in 4 working women are unemployed, and 1 in 4 working women have a child in their household who's under 14. So when childcare falls apart, we know that not only Black women as workers of childcare, but Black women as users of childcare are also falling apart. And more than 10 million of these working women rely on childcare. And with school happening virtually, school that has functioned as a de facto childcare, we know that Black women suffered tremendously. And the rebound, there is not a clear strategy for how then we're going to rebound from such a thing. We also know that the psychological and mental health impact for Black children have been compounded. So I don't want to
And
go on too long, but yes, that's what COVID did.
yes, that's a very big impact on so many lives. I just wanted to touch on one point. You talked about the economic distress, and when it was time to cut or time to, let go people from their jobs, Black women lost on that. Was there like specific? Is it because we have more Black women in the lower wage jobs, or is there specific reasoning, or did you see anything patterns or
Yeah,
for that?
so it is really clear that if we are to give America, Jamaicans say, a bly, if we're to think most optimistic about America and to hold racism over here, right? If we're going to say America is treating all people in all ways, if you're an employer, right, you want and you have to make cuts because American economy is falling apart, then you're going to make decisions economically on the most expendable workers.
Right.
That then tends to be the people who, depending on your industry, are the people who are easily replaceable.
Right.
And Black women occupy, low-wage workers are looking for jobs. They occupy the lowest strata. And so Black women occupying such a strata. But we know that we can't hold racism over here. We know that racism is always at play in every single moment, and it penetrates all factors of our society. So what we know for a fact is that America is hostile to Black people, and it is hostile to Black women. And that hostility is not about an interpersonal hostility. It is about what racism is. So racism is a structure. And so your individual employer does not have to dislike you to find you expendable. So I just really want to emphasize to people this point around racism, because I think it sometimes gets lost that there's an individual worker at the local supermarket that somehow hates Black women, or that there is that people are outwardly mean, and that's what racism is. So the first thing I would say is that the term structural racism is redundant.
Okay.
Structural racism is redundant because racism is structural. And many people do not, when they say structural racism, some people really are trying to overemphasize, but there's a redundancy in the term structural racism. So racism is a system, and when I say system, I just want to kind of make that clear to people. That means it's in absolutely everything. It is in every fabric of our society. So every institution that we have, our first institution is our family, right? Then we have secondary institutions, our school systems. We have our faith-based institutions. We have our criminal legal systems. We have our economic and workplace and occupational systems. We have our global systems. Every single corner. We have our healthcare system. Racism is operating in it because this society has developed a structure whereby some people are privileged. Privilege means unearned access. So like, I did not earn my fingers. I did not earn my eyes. I did not earn my feet. This is a privilege I have as an able-bodied person.
Right.
My skin color, I did not earn, right? I am not super dark skin. I am not super light skin. I get a privilege of not being in the battle at either extreme, right? I can walk. That is a privilege. Whiteness is a privilege. Now, privileges are determined by systems that precede us, right? So my being born able-bodied, there had to be a system that says able-bodied is better than non-able-bodied, right? So in America, there is a system that says if you're born white and named white and agree with whiteness, then you have more privilege. You do not have to personally do anything. So the system's privileges in every corner, whiteness, and in every corner, manness. So that's why Black men can experience certain privileges in certain places and then experience absolute lack of privilege in other places because they got man privilege, but they don't have white privilege, right? So in this particular way, I want people to understand that when the economic system was hit by COVID, it exercised what it had known and knows as its default mechanism, which is racism. That is its default. And that default made and created an opportunity for Black women to suffer. And that system continues to work that way. So discrimination, which is what people usually call racism, is the interpersonal exchange. Somebody calls you a racial slur, they say a mean thing, etc. So that's discrimination, and discrimination is unjust and illegal, and that's why you can take people to court for discriminating behavior. Prejudice is the ideas that people have. So when you take prejudice, the bad ideas, right? And you add it with power and you make it a part of everything, then you've got a nice little system. And sexism is a system, right? So individual workers did not necessarily want to say, we hate Black women, we should fire them first. They looked, and the calculus that organizes their lives, that is racism, led to this outcome, and Black women suffered, and Black children and Black family as a result.
That's a great distinction that you make. You make it in the book as well. And I think it's always great to just reiterate that point because people, you know, it's true, it's very difficult, or not very difficult, but sometimes difficult to see the difference between racism and discrimination. I'm talking about racism as a system versus an individual, you know, between individuals, individual actions, individual moments in one's life that where you might experience discrimination or prejudice, as opposed to living in a system that's organized by racism, if you will.
Yeah, and it's really important that people understand it's racism that gives rise to conversations about race. It's not the reverse. Race is made up by people to put people in categories. Racism, the ranking, racism ranks, right? Because we could theoretically decide that we want a different race at the top. But this particular racism that privileges whites has a rank that whiteness and everything associated with whiteness is better than blackness and everything associated with blackness. So someone who's born that we might call white can choose not to participate and embrace that system. They'll still have unearned privileges,
Right.
but whiteness is a philosophical and theoretical idea that one then has to embrace. And similarly for blackness, Asianness, other things, is that the sophistication of American racism and the institutionalizing of it makes it almost feels natural. We take the unnatural and naturalize it. And in so doing, we create and reify, replicate this system.
I want to talk first. I want to make sure everyone is aware. We have quite a few people on the chat. If you have any questions for Dr. Dias, please send them over. And she's obviously ready to answer and discuss anything related to this topic. I want to go directly into how this impacts us at work. I know we were talking about the pandemic, but obviously we've been living in this structure in America, in this world for before the pandemic started, and a lot of these stressors you talk about in your book, the chapter "Don't Let Her Be the Only," where you talk
Yes.
about how chronic stress and the impact of racism can affect Black women's health.
Yeah.
Some very good detailed description of how the work-life balance and just operating in the corporate structure can affect your health. So you can give us
Yeah,
some
so
more
this is
detail on
this is
that.
quite serious to me because the different and various systems of how we should live is, especially that which governs Black life, suggests that life should be hard. There's a philosophical commitment to the idea that Black people are resilient and we can survive suffering. And to anyone who is listening to me today, I want to encourage us to reject this philosophy. We cannot survive everything. And we will live sicker, and we have and currently live sicker than most populations because of, in some part, due to this philosophy. Black women's overall health is impaired on a lot of different measures, and it starts very early. In epidemiology and public health, we talk about this thing called the allostatic load. And you want to think about it like in terms of having a basket in your hand or a backpack on your back. So you're born in a society that devalues Black people and penalizes you for being Black. It's not just simply that the society, doesn't like you, is that it punishes you for Blackness. So imagine that you are born with this backpack and there's just like a pebble, anti-Blackness, right, in the bag. Over the course of your lifetime, what happens every time you're resilient, you're strong, that you overpower, you overcome, you break through a ceiling, there's more pebbles in that backpack. You can't take the backpack off, right? Because you can't take Blackness off. And what happens is that we have a lot of those encounters and the bag gets heavier and heavier. So we get stronger, right? Like if you train with weights, I train with free weights, you get physically stronger. But if you don't rest, much like with training, you will have injury.
Right.
This is what happens to Black women in the workplace. And it particularly happens to high performing Black women. So high performing Black women and girls are often token in places. And that tokenism, that individual person who has fractured the glass ceiling, has to deal with accumulated and built up insults, more pebbles in the backpack over the course of their lives. And the whole time, they never achieve status of the privileged group, but they are optimistic that they will. And that optimism impairs their physical health. So all women who end up being these glass ceiling breakers experience some psychological damage for it. And in large part, I want to explain to you how that happens, because I'm not trying to push people away from being glass breakers, is that to reorganize systems, you need lots of allies, and you need people who want to see the system revamped. What often happens is that we are vying to become a part of the same unjust system, and we are requiring and needing help from people who created or support that unjust system. And along the way, we are more tired, we're working more hours than other people, we are missing our doctor's appointments, we are taking out our aggressions on our children, and our income does not increase so significantly compared to our peers. Now, compared to our friends, right? Like we might be killing it in Newark, Beth, right? Compared to our friends not at Newark, Beth, but within Newark, Beth, compared to our other counterparts, racial counterparts, our wages are not enough. And then we might be asked to be representatives for our racial group or our gender group or the intersectional groups.
Right.
That kind of psychological problems create not only mental stressors, but physical health challenges. So we know cancer rates are high among women in this position. We know hypertension is high. We know more than 20% of women who are in these kinds of positions experience or report mental distress. So there is a cost to us for this kind of level of tokenism. And the only way to get out of this wheel is if the entire system is reorganized such that you have not only more allies, but more peers. But the process of becoming a token is a process that says prioritize individualism and exceptionalism. So you're not necessarily motivated to be in relationships with others like you in order to make that happen. So I really want to encourage us to move
How do
away.
we navigate that? I have a question here. Can you reflect on how the return to the office might impact Black women? So we've been, working
Yes.
from home, and for those, especially like you talk about the high performing women who've had the ability to do that. So many people who were essential workers and didn't have the ability to work from home. But for those who had the ability to work from home and then are now coming back into this office environment, how do you navigate that?
So I have several ideas. I think one of the things that employees who are people with intersectional identities need to say out loud first to themselves is that the racial stressors of being in mixed race workplace are alleviated not having to go there. Most people are not saying it out loud. It's felt really good not have to be around white folks for the past 15 months. And most people don't want to say that because they think that that might suggest that they hate white people. But there are these microaggressions, these micro insults that happen in interracial workspaces that are unsaid. And so employers really need to better understand that the pandemic, for how horrific it was, did alleviate those microaggressions. And so we're returning to workplaces where those microaggressions are likely to occur, and they may even be different now because Black folks have been communal folks by and large, which is aligned with public health. So Black community, to think about oneself, but oneself in community, is a public health philosophy. And therefore, one might be thinking about, I don't love a vaccine, but maybe, I need to get a vaccine because if I don't get the vaccine, then it impairs the health of my kids, it impairs the health of my grandparents, etc. Very public healthy, right? You might be entering workspaces where people are like, well, I don't really care about that. That's about my health and it's my decision and I get to do whatever. Antithetical to public health. Again, that kind of antitheticalness have actually been aligned with what we would call whiteness, right? Which is individualistic and capitalistic simultaneously. So those things are kind of unsaid in the workplace. The best way to say them is not as an individual. So return to the workplace really demands now that we use our affinity groups. We use our groups that we have been a part of in terms of the Black Alliance, the Women's Alliance, the Gay Alliance, all of these things that are usually employee resource groups in the workplace to send a message of what have been the conditions of work prior to the pandemic. The next thing that I would say is that in so sharing that message, that it not be shared verbally, that it actually be shared in a written way so that employers can better understand that this is a new moment. We cannot continue work as usual. It is a new moment, and a moment of racial reconciliation and work. And for that new moment to come about, these groups need to make clear what are the structural changes that they are asking. And you should ask for those changes prior to. So jobs are all having the like, come in by July this, that by, like there's this tiered entrance. If you do not do this work in coalition, the system will win. And if you try to sidetrack, like, I'm always good with so-and-so and he'll listen to me or she'll listen to me, the side work will not get the structural changes that you need. Because what has happened since 2016 is that there is a deep distrust among Black people nationally for white people. And that deep distrust, again, does not have to be interpersonal. This is a structural issue, is because many Black people worked in coalition with, next to white folks, and then found out that they supported the former president. And that overall distrust is yet another thing that is floating about in many workplaces that are going unsaid. So you might go back to the workplace and you might sit next to your colleague and you say, did you get vaccinated? And that colleague might say yes. But the question is, I thought you wouldn't have voted for the previous president, and you did too. How can I trust you to think about protecting me? How can I trust you to be honest with me? And I think by and large, employers do not understand the overall systemic distrust that exists between Black and white groups in terms of issues of protection. And this issue related to the pandemic is an issue of protection. Will the majority culture do what it can to ensure that Black women and Black families do not die? And that question is still open, and many employers do not know this. And
Yeah.
if you cannot admit it to yourself, and if you cannot make it a part of what your employer knows, it's going to be very difficult to move forward.
Yeah, it's a different time right now. I know there's a lot of conversations that we're having at Newark, Beth Israel and at RWJBarnabas Help. We started a Ending Racism Together initiative, sort of to keep the conversation going on racism throughout, and so that it doesn't end just with what happened with George Floyd, if you will, so that we continue the conversation and we continue moving forward to institute the types of policies that will change or sort of restructure the system and the way that we operate. We do have a question here about how do we sustain ourselves and change the landscape for Black women?
Well, that's the part. So, so in order for public health to happen, we actually really do have to start with individual health, right? So you begin with individual, move to family, and then to community. That's how public health works, right? What happens often is that we stop at individual. So Black women, I only have one thing I ask for you, really, like the first thing to do to sustain what comes ahead. Go to sleep. Go to sleep. And we know that nationally, this society does not sleep enough, and we know our children aren't sleeping enough, and it's actually one of the many reasons we're sick.
Right.
And we need to systematize sleep. We need to make a decision on our bedtime, and we need to sleep. And that is the first thing. Beyond sleeping, do not die over fried chicken. Y'all know that, right? We can't die. I like fried chicken, right? And we should have our fried chicken. We just cannot have it more than once a week. We should move. So the great thing about Newark, Beth, and for the people who are here from Newark, Beth, is that one of the very easy institutional changes that you can make is a demand for meetings to not only be shorter, but for the workplace to actually institutionalize movement.
Yes.
You're in a healthcare system, so you can ask some health stuff from these people, right? So not only can you ask for reimbursement for your gym, you can also ask for movement hours.
Right.
You can also ask, we know that nationally, if people sit more than a half an hour, what it does for their lumbar and what it does for their overall health is that meetings be reduced in terms of time. Like as a healthcare system, y'all should go ham, right, on asking for all of the health stuff. You should be asking for every 10 days that there be some kind of respite, because we know that when people work for more than 10 days, we know that there are some health consequences, right? You should be asking for groups that specifically deal with issues around expressions of anger and frustrations, because it is very hard not to be mad at the nonsense that is America. And that should be for everybody. Right?
Yes.
So there are some very specific things, but in terms of your own personal life, the thing that you have the most management of, because sometimes movement is difficult if you don't do it at work. Sometimes our neighborhoods are not organized to facilitate movement. Sometimes gym costs are too prohibitive, is that we can sleep. And
Right.
so my number one piece of advice that Black women and all people can do to preserve their health, especially as they go back to work, is to institutionalize a sleep schedule such that they rest.
That's great. I'm taking down all these notes. These are great suggestions. I can say that we are moving on the expressions of anger piece, because I know that we have sort of a racial trauma. We're doing something with racially trauma informed care. So I know that piece is moving. I have a question from the audience here, and you talked earlier, I wanted to bring that up. You said optimism can sometimes impair the physical health when you're talking about highly motivated, or women in these in the higher levels of the corporate structure, Black women. And we have a question: how do you excel and find balance so that you don't fall into the pitfalls described?
So you can excel individually, but you cannot find balance individually if the structure is such that it is 90% a group that is not invested in your well-being and you. This has been the false story that has been told. You're like, I'm the one powerful Black person, Black woman, able-bodied person, and I'm going to transform the structure. It is impossible to transform structure without coalition. And so it is really a matter of time that you will be impaired. For some people, it's 10 years. For some people, it's 5. For some people, it's immediately. But what has to happen if you want the structure to be more inclusive and more equitable is there must be more, not only like-minded people of you, but the group that is 90 over here, that many of those members have to come over to this side. And so being optimistic that you're going to be the lone warrior that fixes everything, that likelihood is very low. It is not impossible. It's just very low. And the likelihood is that you will become ill in the effort to do so. So we know that MLK had high blood pressure. We know that the same for many of our leaders have died because of behavioral health issues. Right? Not cancer, behavioral health issues. In an effort, we should not be dying in an effort to save our people. This sacrificial kind of framework, I urge us to deviate from it and choose a different path. We need to be healthy leaders, healthy champions of change.
Right.
We should not throw ourselves on the cross.
Thank you so much, Dr. Dias. This has been a great conversation. I think we are coming to the end of our time with you. Again, it's been an honor to speak with you and gain all of this knowledge. I encourage everyone to go out and get the book. I have my copy right here. Parent, Like It Matters, How to Raise Joyful, Change-Making Girls. It really is. And I don't have a girl, I have a little boy, but I am using the advice. I know you told me that it's good for all genders, right? It's good
It's good
across
for
all
all
genders.
genders. And you should know that I have a very good friend who's like, we really need to just cut off these girls, because so much of the book talks about these issues that I talked to you about today. Plus, I am trained in thinking and working on organizational matters. And so what I want to make it clear to those of you who are on this call and everywhere is that the book really does give you the social science, the public health, and all of these things together so that you can use them. Because I work so closely with girls and with women and families, I use them as an example, and I wanted to honor that. But it's very, very useful in all kinds of different ways. And lastly, I will say, for those of you who want to hear me talk a little bit more about what organizations can do and self-care, tonight at 8 o'clock, I am on a live with OIC America, and you can find it on my Instagram page, which is Dr. Janice Johnson. And you can join me and ask me even more questions and engage with me more fully about how we can really take care of ourselves beyond sleep. I'll be going into specific details of strategies to mitigate, build coalition, and work with systems and with your friends and family as you deal with racism and this return to work.
Thank you. Thank you so much. So you can definitely pick up the book, your local bookstores, online.
Source of knowledge in Newark.
Yes, Source of Knowledge in Newark. And for those of you, we have something coming in the mail for our first 5 registrants to this webinar. You will be receiving an autographed copy in the mail. So look out for that. Thank you, Dr. Dias. And tune into our next webinar, which is coming up this evening at 6 o'clock, the Paint and Sip with Simone Anthony Brown. So we're
Great
excited.
way to stay healthy.
Yes, stay healthy, de-stress, relax, and we're looking forward to it. That will be the last one in our series for this year, Women's Wellness Wednesday.
Thank you so much for having me. I really appreciate it. I love, as everyone knows, love Newark, Beth, and I can't wait to figure out how to get this book into the maternal units. So for those who are having girls in every way. So we will see each other again very, very soon. And again, if you all want to follow the work of the Grassroots Community Foundation, please see us online at Grassroots Found or grassrootscommunityfoundation.org. And you can just Google Grassroots and you'll see us pop up with our logo. So I am grateful to be able to talk to you this afternoon. I appreciate all of the support I've gotten over the years from Newark, Beth, and from this team.
Thank you. Thank you so much.
Thank you. Have a great day, everyone.
All right. Have a good day.